Now we're going to invite Ms. Dawn Edwards to speak with us. Ms. Edwards is a self-described 32-year chronic kidney disease warrior. She's experienced firsthand every mode of kidney replacement therapy, including a kidney transplant and a rejection. She's currently a nocturnal home hemodialysis patient and is pursuing a second transplant. As a result, she has a plethora of insights into the needs of people with chronic kidney disease, always keeping in mind that patients need different things at different times in their lives, as Dr. Pearl just talked about. Ms. Edwards is dedicated to improving the quality of life of people with kidney disease and is also a resource to her community, sharing her story and educating people about the relationship between hypertension, diabetes, and kidney disease, especially among underserved communities and communities of color. Ms. Edwards has served the community for over 25 years and is currently on the board of directors of the iPro ESRD network of New York. She serves on many other kidney disease-related boards and has reinvented herself by working as a patient advocate for Fresenius and NextStage and a wellness ambassador for the Rogosin Institute. She's also a co-chairperson of the Forum of ESRD Network's Patient Advisory Council, KPAC, board of directors, a member of the board of directors of Home Dialyzors United, HDU, and is actively involved with the National Kidney Foundation, the American Kidney Fund, and the American Association of Kidney Patients. She serves as a patient advisor for the HOPE study, as well as the community advisory board in the HEAL study, working with the NIH and NIDDK. She's a member of the Health Equities and Health Disparities Work Group and serves on the NIH NIDDK Advisory Council. She is also CEO of her own advocacy and education organization, the New York State CKD Champions, whose motto is to educate, encourage, and empower. Ms. Edwards has been published in the January 2021 issue of the Clinical Journal of the American Society of Nephrology with an article titled Personal Experiences of Patients in the Interaction of Culture and Kidney Disease. She's published 5 other white papers in nephrology journals, and we're thrilled to have her join us today. Ms. Dawn Edwards.
Good afternoon, everyone, and thank you for that introduction, Dr. Silberswag. You made me tired just listening to all of the things that I'm involved in. Let's see, can we get it started? And I also want to thank Dr. Pearl and Dr. Silberswag for wonderful presentations that preceded me. Such great information. I hope we take all of that information to heart. Today, I'm going to be talking to you about chronic kidney disease, education, and peer mentorship. So just to give a little background information, I know Dr. Silverswag talked a great deal about all of the things that I'm involved in, but just wanted to drill down a little bit about who I am. And my kidney journey includes 4 years of in-center hemodialysis, 10 great and successful years at peritoneal dialysis, 6 years with a kidney transplant, and 12 years of home hemodialysis. I'm currently a nocturnal home hemodialysis patient, and I'm on the wait list for my second kidney transplant. So you can see here, I travel with my home hemodialysis machine, excuse me, and I'm very active, and thankfully, because of home hemodialysis and home therapies, I've been able to reinvent myself. And as Dr. Silberswag talked about earlier, because of home therapies and kidney transplant, I've been able to return to work, which is one thing that a lot of our patients are not able to do because of their restrictions with in-center hemodialysis. So I wanted to talk to you today about why patient education and peer mentorship is necessary. And one reason why this is so necessary is because CMS says so, and we know CMS is the payer of 80% of our dialysis and transplant care. And CMS is trying to create an environment um, they call person-centered care. And person-centered care is defined as integrated healthcare services which are delivered in a setting and manner that is responsive to the individual and their goals, values, and preferences in a system that empowers patients and providers to make effective care plans together. And I really like that that empowers patients piece, because empowering patients makes a difference in whether our patients are part of the care team or they're just patients. And we'll talk about that in a little bit of detail. So how do we achieve this person-centered care that CMS is pushing us towards? Number one, we achieve that by empowering patients. And by empowering patients, that means that they are a part of the care team, they're activated, they're excited, they're asking questions, and they're participating in their care. And one of the things that I've learned over my 32 years as a kidney patient is that understanding your condition gives you power over it. I didn't understand, or I wasn't able to manage my kidney disease until I learned about it. And back in 1992, when I was diagnosed at the age of 22, there wasn't a lot of ways of obtaining information. We just started out having home computers, and I had to learn a lot of things on my own because there wasn't a lot of information and resources available. But when I did get involved with my ESRD network and I started to learn about kidney disease and how to manage it, I left in-center hemodialysis and I started doing peritoneal dialysis. And when I started doing home therapies, I felt so much better getting more frequent dialysis. I actually woke up and it was an overwhelming feeling of well-being and being able to re-enter life. And I call it getting your wings back. So by giving our patients education, we have an opportunity to do a similar thing for them. We can give patients their wings back. And all of that is achieved with education. And we all know that knowledge is power. So the empowered, educated patient gives you a great deal of benefits. Number one, your patients will begin to ask questions and participating in conversations with the members of their care team instead of that adversarial attitude that creates tension in the healthcare environment. And it also helps to build trust, and we know that in our communities of color, unfortunately, we've had a hard time with getting patients to comply to their healthcare regimens because they don't trust. Well, we can help patients to become empowered by giving them that education and building that trust. Then the patient becomes a part of the care team. They understand what's necessary so that they can feel healthy and they can feel better. They have the opportunity for shared decision making, and that's really important because the family, the loved ones become involved, and the improved communication between the patient and the care team members, it just creates that whole sense of community. The patient, the family is talking to their doctor. They're making these informed decisions about their treatment options. They're more likely to select these elective procedures like vascular access, getting rid of the catheters, going for their grafts and their fistulas, and listing for transplant. And all of this rolled up into a big ball creates that empowered patient. And that improves the chances of what everybody wants in the long run, which is improved outcomes and compliance. As physicians, that's what everybody wants to see. We want to see improved outcomes, and we want our patients to comply to the prescriptions that's given to them. We want them to take their medications. We want them to feel better and have better quality of life. So, how do we educate patients? It can be a difficult question. There are certain barriers that we have to recognize. Of course, we know that there's a national staffing shortage. How do we get patients educated when we don't have enough staff to educate them? There's always that time barrier. In the in-center hemodialysis setting, there's no time. We have to hurry up and get patients on the machine. We have to get them off the machine. Um, where do we get the time to sit down and provide this necessary education? Then there's also that inability to relate to our patients because of cultural differences. Not only because of cultural differences, but when a patient is newly diagnosed, we don't even have we don't have the ability to hear what is being said to us or what is trying to be taught to us by the care team members. And then there's that feeling of mistrust that I talked about earlier in our Black and Brown communities, the inability to trust the people in the medical profession. There's those huge communication challenges that we have to overcome, language barriers, along with health literacy. I don't know how many times I have talked to patients chairside and I asked them questions about, how are they managing their health care or how are they feeling about what their doctor said to them. And they tell me, I don't understand what they said. There's technology that we have had to jump into because of the pandemic, and a lot of our patients weren't ready. There's that telehealth that Dr. Pearl talked about earlier. It was a great resource that we had to switch into quickly, but a lot of people weren't ready. And we talk about disparities, people that don't have Wi-Fi, and then the literacy issue where people may have had a smartphone and didn't know how to use them. How do you tune into a Zoom telehealth appointment? A lot of our patients still don't know how to do that. And then there's written literacy that we have to contend with, where people don't really read well. And you can't just hand a patient a brochure or a flyer and expect them to be able to understand or to check off a box and say we educated them like that. So these are all barriers that we have to contend with educating our patients. So that's where we get into peer mentors, which are a huge underutilized resource. Peer mentors have been around for many, many years. We've heard about it in the healthcare system, but we haven't really utilized them to their full potential. Well, thanks to the Llewellyn Grant, the Rogosin Institute has the opportunity to utilize peer mentors in the healthcare system with our Rogosin wellness ambassadors. And you saw a picture of us in Dr. Silberswite's presentation. And we at the Rogosin Institute, the wellness ambassadors, are in the dialysis facility, interacting with our patients and helping them to get their wings back by empowering them with education. So I'm going to talk to you a little bit about the peer mentor in chronic kidney disease care. So peer mentoring, of course, is a form of mentorship that takes place between a person who has lived experience and they mentor to a person who is new to that experience. And we wellness ambassadors, we provide that boots on the ground, hands-on interaction. We're right in the peak clinic. We're right in the dialysis facilities, and we're able to sit down and have that conversation with patients. We're able to spend that time that some of the members of the healthcare team just don't have. Not only that, but we're able to provide that interaction with patients with someone that looks like them. If you took a look at that picture Dr. Silberswag presented earlier, you see that we are a very diverse group of people who speak various languages, and we look like the patients that are sitting in the chairs. And we, as peer mentors, are able to assess and address the specific needs of each person by speaking to patients individually. We're able, in a few minutes, to be able to detect what it is that that patient needs, and we're able to talk to them on their level in a way that they understand, a lot of times, even in their language. And we, as peer mentors, are also allies to the clinical care team. So we talk to the members of the care team as well. We don't just come in and talk to the patients. We work with the members of the staff as well. And it's absolutely amazing what can be gained by these interactions between the peer mentors, the clinical care team, and the patients. And it's beneficial for the mentor as well as the mentee. Um, we, as the peer mentors, we get a payoff out of being mentors as well. Not only do we get to share our experiences and provide our perspective, but we get a great take home as the feeling of accomplishment by being able to help someone else. And the regular interactions with the patients and the staff, it builds even more trust. The staff gets to learn that patient perspective, and they feel more comfortable talking and interacting with their patients because they're able to ask us as ambassadors questions, things that they want to know that they haven't been able to ask their patients about how to deal with the challenging patient. What is it that patients, what is it that the body language that patients are showing when they don't want to talk? And how do they intercept or how do they deal with that patient that is displaying negative behavior in the dialysis unit? So ultimately, um, with all of this interaction between the staff members and the patients and talking to the patients regularly and giving the information and resources that they need, um, our patients get their wings back as well. So, as I said, we as wellness ambassadors are able to provide that hands on interaction. And due to the pandemic, we weren't able to go into the dialysis units. And, as was stated earlier, the pandemic created a great deal of stress with our patients that were in the dialysis centers. I was frightened for the patients that were in the dialysis centers because they were so vulnerable to infection of the virus because they were in this congregate environment. Well, we as ambassadors couldn't go in to talk with them and visit them and comfort them, but we were able to talk to them on virtual platforms like Zoom. We were able to talk to them on the telephone, but we were so happy when things, finally calmed down and we were able to go back and visit with them in person in the dialysis centers. But, during the time when we had to, we used all of these mediums to be able to communicate with our patients to provide them with that support that they needed. So we as wellness ambassadors are absolutely able to address our patients' specific needs. We can speak to patients on a been there, done that level. And when we enter the dialysis unit, a lot of times we speak to the clinical manager before we start to go around and talk to the patients as they're coming in and out of the unit. Sometimes the clinical manager will tell us, give us direction where a specific patient may need a little talking to by a wellness ambassador about their vascular access, or another patient may need more information about treatment options. We've talked to patients about uh, the kidney diet and how difficult it is to manage that. Well, we can tell them some of the tricks or some of the ways that been able to manage our kidney diet. Compliance issues, which are really difficult for staff members to talk to a patient about. Well, we as fellow patients are able to relate to our patients and help them to overcome some of those barriers that are keeping them from being compliant to their treatment and also to their medication regimens. It's just amazing, some of the things that we've been able to accomplish with our patients. One of our wellness ambassadors talked to a patient, and it was something as simple as the dialogue that we use. The patient was told to eat, not to eat a certain type of cereal, brand cereal. And in his language, everything that was cereal was cornflakes. And he thought that Raisin Bran was cornflakes. And she was able to help him to understand that Raisin Bran and cornflakes was not the same thing. And that's just a small thing, but that makes a difference in the patient's phosphorus levels. We talk to patients about not missing treatment and the importance of coming to all the treatments. We see the difference in the amounts of blood that's filtered in every dialysis treatment. So missing one treatment makes a huge difference on how our patients feel, in the overall big picture. And we talk to them about adjusting to the kidney journey experience as a whole. In the PEAK program, it's so difficult for patients to understand what is happening to them when they're newly diagnosed with kidney disease. And, a lot of times we want to just act like the whole thing is not happening and we're in a state of denial. Well, we're able as peer mentors to talk to these patients because we understand how it feels, and that fear of being newly diagnosed with a chronic kidney disease, and we can relate to them on that been there, done that level. And a lot of times we're able to bring the patient back and to help them to adjust and help them to feel a little bit more comfortable with what's happening to them. And we're able to give them that reassurance that everything is going to be okay, and we can help them to adjust to their new diagnosis and to help them to achieve that quality of life that they so desperately are trying to hold on to. So one of the things that is really important that we are sure to adhere to, and every peer mentor that comes into a peer mentor role is trained to direct the patients to the appropriate care team member to get the information and resources that they need, and not to give any medical advice or to contradict any of their orders by their medical care team. And that's why it's so important to select the right peer mentor. Not every patient can serve as a peer mentor. So just because a patient says, I want to be a peer mentor, that doesn't mean that you can serve as a wellness ambassador. And our wellness ambassadors have been very, very carefully selected. So we as wellness ambassadors are allies to the clinical care team. We provide staff in services, which is really a lot of fun. We go to do what we call lunch and learns with the staff members, and we've done this at Brooklyn East, at the Auburndale, and the Brookdale facilities. And we do something called a talkback series where we spend a few minutes giving them an in-service on how to deal with a challenging patient, how to talk to patients about changing modalities, home dialysis, how to talk to patients about getting listed for transplant, and how to communicate with the patient that doesn't want to talk at all. And then we give the staff an opportunity to talk back to us and tell us about some of the challenges that they face. And we're able to provide them with that patient perspective, and we're able to help them to relate to their patients a little bit better, and how to get through some of those communication barriers. And by these talkback series and the in-service and training, we are able to develop a rapport with these care team members. A lot of them know us by name, and they look for us when we come, or they'll have a one of our postcards, and they'll give it to a patient and say, why don't you call and make an appointment and talk to one of the wellness ambassadors? They'll be able to help you with some of that information that you need. You can call and talk to one of the wellness ambassadors. They've done home hemodialysis, or they've been through the transplant process, or they can help you with more information on how to multi-list. So this rapport that we've been able to develop with the care team members has made us as wellness ambassadors a valuable resource within the care team structure. So just some of the makings of a great peer mentor is that, the great peer mentor, as I said, may or may not be in the facility. Um, the Rogosin Wellness Ambassadors actually are all transplanted patients, but we all have various various kidney journeys. Some of us have never done home dialysis. Some of us have done PD. Some of us have multi-listed and got a kidney transplant. So, I mean, we just come from all different types of kidney journeys. And you also want a patient that is managing their journey well. All of us are relatively healthy, and we're doing well on our kidney journey. So we're able to share those tips to our patients. And they also should be representative of an empowered patient, because that's what we want to invoke on the patients that we serve. We want to show that we are living well, and we want to invoke wellness to our patient population. All of the wellness ambassadors have received training. And we have experience in the community from various kidney organizations, as well as been trained from our ESRD networks. And we're from a diverse background, so we can absolutely address different patient needs. We have wellness ambassadors who can speak Spanish. We even have a wellness ambassador that can relate to our patients of Asian descent and speak to them in their language as well. A peer mentor absolutely needs to understand the facility dynamic because every one of our Rogosin facilities has a different culture, and peer mentors are and our wellness ambassadors specifically are friendly with the staff members and knowledgeable of the role of the care team members and able to provide plenty of other resources. We're skilled in referring our patients to iPro. Sometimes they may need to speak to someone at their ESRD network, and we also have some knowledge of how to manage the Medicare and the Medicaid systems. So, as I said, it's absolutely amazing what can be gained from having wellness ambassadors in the facility. We're an inspiration and a motivation to staff. By the staff members hearing our stories and our lived experiences, it gets them excited when they hear that I've been successful for 12 years as a home hemodialysis patient and that I'm a 32-year kidney patient. They get excited and they want to tell their patients, wow, you need to speak to Dawn. She's doing great as a home hemodialysis patient. Or, some of our other wellness ambassadors are doing great as transplant patients. They get really excited when we come to refer their patients to speak with us. The patients as well as the staff, they learn things that they didn't know. At some of our staff huddles that we've had, the staff members learn things about home dialysis that they didn't know. A lot of times, some of the staff members have some myths and misconceptions about home dialysis and transplant that we're able to debunk and give them some information based on our kidney journey. We're able to provide the patients with the valuable information and resources that they need to pursue that transplant listing or to direct them to our home dialysis department so that they can get more information and hopefully start that home dialysis training that they were frightened about before. And now our patients are starting to look for us. And when they see the wellness ambassadors, they ask for a specific one because they trust us now. And the credibility it has been built because they see us more often. And we're able to spend time that the clinical care team just doesn't have. It takes us sometimes a half an hour. We can sit down and talk to a patient in the unit, and that half an hour can be very valuable because in that time we can take a patient that has said, I don't want to hear anything about home dialysis. And by the time we're finished talking to them, they're saying, sign me up. I'm ready to go home. Or I'm ready to get listed for that transplant that they were completely against before we started talking to them. And good mentors can add a healthy environment for everyone in the clinical care in the unit. We can provide valuable information. We help the patients understand the information that's given to them. They may have a brochure or they may need more information or they don't understand something. Well, we have our Rogosin Wellness website that we can direct them to that we built ourselves with information on treatment options, on transplant, on diet. And we can sit down with them and we can help them understand that information to get their needs met. And these patients, they do things that they wouldn't do before we started interacting with them. Like I said, we've gotten patients to try a home therapy. We've talked to patients and we've convinced them that it's time for them to get their vascular access and, to get rid of their catheter. We've talked to patients. I've personally talked to a patient recently that was completely against taking phosphate binders, but he didn't understand what the phosphate binders did and what the importance was. Well, by the time we got finished talking, he was like, "Oh my goodness, I didn't know that that's what those pills were for. I'm going to start taking them now." Just by a few minutes of interaction, we've been able to do things that these patients weren't doing before. And this is how patients get empowered, they become activated, and they get their wings back. And like I said, it not only helps the patient, but it helps us as peer mentors as well. Just by me being around my fellow wellness ambassadors and interacting with them, all of them have transplants, and I'm the only wellness ambassador that's still on dialysis. Well, by being around them and being a part of uh, the wellness ambassador program, they convinced me to go back and get transplant listed. So after 12 years of home hemodialysis and being afraid to get back on the transplant list, I got back on the list, and hopefully I'll be getting transplanted myself soon. So it not only helps the patients that we're talking to, but it's helpful to us as well. So our wellness program really helps us and our patients to get their wings back. We have our peak program outreach where we talk to patients in the CKD stages. And, that's like one of the most rewarding parts of our work because I remember when I first was diagnosed and there was nothing like a peak program where you could get this interaction with a clinical care team before you start dialysis to get that counseling that you need. And you, as well, you get the education, you get the outreach, and that whole wraparound program with the diet, the vascular access, the treatment options, all of that before the need for dialysis. Wow. I mean, I think that's just an unbelievable and underutilized resource. So we have that great peak program outreach that we do. We have the new dialysis patient and family orientation that our nurse educator and the wellness ambassadors provide to the patients. There's the staff engagement and education that the nurse educator and the wellness ambassadors provide. And then, as I said earlier, there's our wellness website, and the web address is located there for your convenience. That was specifically designed by the wellness ambassadors. And it's not just for patients, it's for the clinicians as well. I know that our director of home therapies, as well as other doctors, use the Rogosin Wellness website and show it to patients to help them to see how help them see the benefits of home therapies and what do you do? How do you get started on a home therapy? We have videos on that wellness website that are by us wellness ambassadors, as well as we have voice recordings where you can hear us talk about the benefits of home therapies and transplant. And the wellness ambassadors ourselves, we're available to the entire nephrology department. So we are a busy bunch of people doing some really rewarding work that we really enjoy and we love. And myself being a wellness ambassador and being a patient advocate for over 29 years, I couldn't say um, how much I really enjoy interacting with patients, providing them with these necessary resources, talking to them in the language that they understand, and really being able to focus on these two facilities in Brownsville and East New York, two of the most underserved communities in our 5 boroughs, and providing these patients with the information and resources that they need to make those informed decisions. And we're not only reaching out to the patients, we're reaching out to the families, and we're just able to provide that support that patients need, and that they so richly desire. So with that, I just want to thank you so much for your attention, and thank you so much for the opportunity to present to you. And I just want to give a big shout out to our wellness ambassadors and the entire wellness program that's listening to us this afternoon. Thank you so much.
Thank you, Ms. Edwards, for a wonderful presentation. And as everybody can see, we clearly have selected our wellness ambassadors very carefully and very successfully.